before you open that pack of chips, numerous studies link obesity to a higher risk of serious illness from the new coronavirus. It can double your chances of hospitalization and increase the risk of landing in intensive care by even more.
In Mexico, preliminary data shows that the severity of COVID increases by 44% in overweight people.
Obesity can also lead to heart disease and diabetes, both of which also increase the risk of developing a severe case of COVID-19.
If you eat 5 crispy pigskin tacos, then you have to push yourself to burn some fat.
It's time to talk about your waistline. Could this crisis finally convince you to join that gym or start eating healthier? Fast food-loving South Africa is the third fattest nation on earth, and it's complicating the nation's fight against the virus. Doctors say overweight South Africans are straining the health system.
Cardiologist Jeff King has been kept busy since COVID-19 reached South Africa's shores.
So I see that your body weight is 102 kilograms. Okay, so you have got a weight-related issue, and we'll work out what your body mass index works out to, but it looks like you're bordering on a weight-related issue called obesity.
With over 20% of the population living with HIV, there were initially worries that millions of immune-compromised South Africans could cripple the country's fight against COVID-19. But there are bigger problems.
Because Africa has been known to be the mecca of HIV, we were concerned that the immunity responses that patients had in HIV would result in a greater pandemic. On the contrary, we actually found the exact opposite, that the biggest factor that we had related to aggravating COVID infection was obesity. And South Africa is the third heaviest nation in the world. First is America and second to the UK.
Like many worldwide, Dr. King thought COVID-19 was primarily a respiratory disease.
And because we only included...
But experts like these at the virtual 2020 European Society for Cardiology Congress have identified obesity as a major factor.
Study participant had a high burden of cardiovascular risk factors with hypertension, obesity, hyperlipidemia, and diabetes, all exceeding 40%.
As the virus proliferates around the globe and more is learned about its effects on the body, they are realizing this comorbidity could mean the difference between life and death.
The inflammatory response that the actual obesity causes enhances the cardiovascular complications and the diabetic complications of patients remaining overweight. This will eventually lead to further lung problems that leads to decreased oxygenation, which ultimately becomes the major limiting factor in terms of overall mortality.
With higher instances of diabetes, hypertension and cardiovascular diseases among the general population due to obesity, South Africa is at particular risk for as long as there's no cure for COVID-19. Meanwhile, the overweight need to seek solutions.
I'm seeing a dietitian, especially now during COVID-19, because I am overweight, and I think I need to lose a bit of weight so that in case I get infected, I'm not in the danger zone. And I also feel like this is an opportunity for me to start embracing a healthier lifestyle.
And amid high rates of poverty and inequality, affordable and popular staple foods in South Africa are often high in fat and processed carbohydrates.
What can actually be done to make the situation better is just to avoid processed foods, to eat 3 meals a day and make sure that we cook our own meals at home. And the other problem is a lack of physical activity, and what we can do is to exercise at least most days of the week.
As much of a challenge that COVID-19 presents to global health, it also offers an opportunity for many to adopt a healthier lifestyle.
The World Health Organization refers to obesity as a global epidemic in itself. Since 1975, the numbers have nearly tripled. In the United States, almost a third of the population is overweight. In Russia, some European countries and South Africa, more than 20% are considered obese. Canada, parts of South America and Australia also make up the top 20. Well, a team from the University of North Carolina took 75 studies from around the world, including nearly 400,000 patients. It concluded being obese increases the risk of dying from COVID by nearly 50%. Barry Popkin led that study from the Department of Nutrition and joins us now. What surprised you about the findings, Barry?
Well, two things. First, the proportion being hospitalized. You're more than double the likelihood of being hospitalized if you're a person with obesity. So obese individuals are 113% more likely to be hospitalized, and then that mortality statistic. Both of those were far beyond what anybody had expected and far higher than we see from individual diseases like hypertension or diabetes.
And why is that? What's the explanation?
That when you're obese, in and of itself, you have a large immune impairment. So your immune system doesn't work as well. And then on top of that, many of the other metabolic changes just make it more likely that you'll catch COVID and that you'll get more severe COVID because you don't have the antibodies to fight it. And then on top of that, if you're obese, which is about 25% of Germans and more than 20% of every country in the world, you then find that you have a physiological impairment. Your lung capacity is limited, and we need to do special things just to enhance that. And this virus attacks the lung system, so it just adds to the problem and the reason for mortality.
You mentioned a weaker immune system. Is that the reason why some are warning a vaccination may not be as effective in obese people?
Exactly. We know from 2 coronavirus vaccines, the flu vaccine and all the experimental work with the SARS vaccine, that they don't work as well. In fact, the U.S., for the first time, will have a booster vaccine for obese individuals and the elderly, so that you'll have a stronger flu vaccine for those who are obese.
So what about all these people who've been shut up in their homes for so long, some not even allowed to go outdoors to exercise? Are we going to see an increase in obesity because of this pandemic?
Yes, we're seeing that across the globe in all the countries we work. We're finding inactivity combined with buying, especially among the poor, buying cheaper, ready-to-eat or ready-to-heat, highly processed junk food, buying more sugary beverages. All are adding to the problem. And we're seeing unhealthy eating increasing among low and middle income populations across the globe.
Barry, surely this would have to be a wake-up call for people to change their habits, change their lifestyle.
It would be, but I think this has to come from governmental regulations and other changes. We can't change the food environment, and without changing that, we're really going to have a very difficult time getting except a few individuals to change their eating behavior and activity behavior.
Barry Popkin there, he headed up that study on obesity. Some very interesting and surprising results there, as he mentioned. Hope you were listening in. Thank you very much for joining us, Barry.
My pleasure. Bye-bye.
Now, if you've got questions about the coronavirus, feel free to get in contact with our science correspondent, Derek Williams, on our YouTube channel. Here he is.
Dogs are being trained to detect COVID-19. But when they're in places like airports, detecting the virus on travelers, could the dogs contract the virus from them?
Dogs have incredibly sensitive noses. Some estimates say up to 100,000 times more sensitive than our noses are. And they can be trained to sniff out illnesses. That's been shown in a range of diseases, from malaria to cancer. And there are a number of teams all over the world currently teaching them to detect COVID-19 with various degrees of success. In fact, corona-sniffing dogs have already been deployed in Dubai International Airport. They can do it because like in other illnesses, SARS-CoV-2 influences your metabolism in certain signature ways. In other words, COVID-19 will cause someone to have a very specific scent. And some canines, at least, can be trained to recognize it. But you're right that it's a little tricky to keep the dogs from potentially catching the virus too. I mean, we know that they can catch it, at least in certain circumstances, although it doesn't seem to affect them as badly as it does us. But to avoid any transmission risk, in Dubai, the sniffer dogs are physically isolated from the passengers who randomly submit armpit swabs, which hold the scent, but not the virus. It sounds like kind of a clumsy system, but it's one that protects the animals. And their accuracy rate is reportedly over 90%. But don't expect troops of canine COVID-19 sniffers to become common in airports anytime soon, because training them is apparently a pretty expensive and time-consuming process.